The fluorescent lights hummed overhead as Katie Morrison pushed through the trauma unit doors at 6:24 a.m., her badge clipped to the pocket of pristine scrubs. Seattle General's emergency department breathed in rhythm, machines beeping their mechanical heartbeat, the shuffle of tired feet on polished concrete, the hiss of pneumatic door seals releasing. The place smelled like antiseptic and strong coffee that had been sitting in the break room pot since 4 a.m. She'd been here 6 months. Still invisible to most of them. The trauma bay stretched before her in its usual organized chaos. 3 beds occupied, 2 nurses moving between them with the practiced efficiency of people who'd stopped thinking about what they were doing and started trusting their muscle memory instead. The stainless steel stretchers gleamed under harsh white light. Ventilators wheezed their mechanical rhythm. A cardiac monitor beat steady. Everything normal. Everything routine. Everything the way it was supposed to be. Katie set her bag in her locker, the small one in the corner of the break room that nobody else used, and pulled out the folded flag. 3 by 5 inches. Worn corners that had been creased the same way for 8 years. She placed it on the top shelf where it always went, back left corner, behind the extra pair of compression socks she kept in case someone coded and she needed to be on her feet for 14 hours straight without her calves giving out. The flag was from Rodriguez. 3rd Battalion, 5th Marines. Ramadi. 2007, she straightened it once, made sure it was aligned perpendicular to the edge of the shelf, and closed the locker door without looking at it again. Morning, Katie. Nurse Jen passed her in the hallway, 2 trays of medications balanced on one hand like an acrobat. We've got a GSW in Bay 3, MI in Bay 1, and they're bringing in a pedestrian hit. Could be busy. Got it, Katie said. Her voice carried the careful neutrality of someone who'd learned long ago that speaking too much made people look at you. I'll get the crash carts restocked. That was the thing about being new. About being the person who didn't have a medical school diploma hanging on an office wall. About being the person who showed up, did the work, asked the right questions, and then disappeared back into the background between shifts. The doctors didn't know what to do with quiet competence. They expected nurses to defer, to ask permission, to look confused when things got complicated. Katie had learned to give them what they expected. Dr. Pierce arrived at 7:22 a.m. the way he arrived every morning, trailing hospital politics like a cologne, his white coat tailored in a way that suggested money and connections in equal measure. Mid-50s. Silver hair that looked expensive. The kind of presence that made junior residents straighten their spines and attending physicians nod in recognition. He'd been the chief of emergency medicine at Seattle General for 11 years. He was the kind of doctor who didn't ask questions. He delivered answers. He was also, Katie had learned in her first 2 weeks, the kind of man who preferred to be right more than he preferred to be helpful. She caught him staring at her from across the nursing station around 8:15 a.m. Not the normal looking for information stare. This was different. His eyes tracked her as she moved through the trauma bay, checking vitals on the GSW, adjusting the flow rate on the MI patient, noting that the pedestrian victim's Glasgow coma scale was dropping and somebody needed to call neurosurgery. She'd learned to work while being watched. It was a skill that developed naturally after enough years of someone always keeping track, always paying attention to whether you were doing things right. Morrison. Dr. Pierce's voice cut across the noise of the bay like he was used to the world stopping when he called. You have a moment. Katie finished documenting the neuro check and turned to face him. Her hand stayed loose at her sides. No tension. No hesitation. Of course, doctor. He gestured for her to follow him into the medication room, the small locked space where they kept the controlled substances and the equipment that cost more than most people's cars. The door swung shut behind them and the noise of the trauma bay became something distant and underwater. His presence took up space in the small room the way certain people's presence always did. Not threatening. Just there. Occupying the oxygen. I've been reviewing your personnel file, he said. His eyes moved to her locker through the small window. Through the glass, the folded flag was barely visible. Just a suggestion of fabric and color. And I noticed some peculiar items. Personal effects that don't align with standard nursing protocol. Katie met his stare. Flat. Unblinking. The way she'd learned to look at people when she needed them to understand that she wasn't afraid of them. It's a memorial, doctor. For a friend who passed. A memorial. He said the word like it tasted strange in his mouth. In a hospital locker. Where patients and staff can see it. That's inappropriate, Katie. Hospitals are about moving forward. About science and treatment protocols, not sentimentality. She didn't respond immediately. The silence stretched between them like a wire pulled tight. When she did speak, her voice came out calm and measured. I'll move it if it bothers you. He studied her for a moment longer, then nodded once, sharp and precise. See that you do. He turned toward the door, then paused. Also, I'm restructuring the trauma rotation next week. You'll be working evenings. Starting Monday. He left before she could acknowledge the order. The medication room felt larger after he was gone, the way spaces always did when you finally exhaled. The rest of the morning moved the way emergency medicine always moved, crisis and calm alternating in rhythms that nobody could predict. The GSW stabilized. The MI patient went up to cardiology. The pedestrian victim got intubated by the respiratory team at 11:33 a.m. with her Glasgow coma scale at 7, which meant she was going to need neurosurgery fast. Katie ran bloods, set up the rapid infuser, made calls to the lab and to the surgical floor. She moved through the trauma bay like someone who'd done this exact dance 1,000 times before. Quick. Efficient. Invisible. At 1:06 p.m., the attending physician, Dr. Reeves, good man, former Army medic who transitioned into emergency medicine the way some soldiers did, was reviewing the pedestrian case. He stood at the bedside studying the girl's imaging on the tablet screen, his face creasing in the way it did when something didn't add up. 23 years old. Blunt force trauma to the right temple. Initial CT showed no intracranial hemorrhage, but the clinical presentation suggested otherwise. Something was wrong with the picture they were seeing. BP's dropping, Katie said quietly, moving to check the monitor. 118/62 and sliding. Dr. Reeves kept studying the image. It doesn't match the neuro picture. The scan should show something. Katie had learned long ago not to speak up unless she was certain. Certainty was the currency that made people listen. She'd also learned that sometimes the picture you were looking at was the wrong picture. Subdural bleed, she said. Her voice stayed quiet. Just stating information. Small. Maybe not showing on the conventional CT diffuse axonal injury pattern in the neuro picture. I'd recommend a CTA before the next set of standard films. Dr. Reeves looked at her. Really looked at her, not through her. The CTA was already ordered 2 hours ago based on her neuro picture, he said. His tone wasn't condescending. It was just factual. You read the chart? No, sir. Just the clinical presentation. He turned back to the monitor. When it comes back, I'm betting it shows exactly what you just said. Subdural. Small but bleeding. He paused. Good catch, Morrison. You have good instincts. She nodded once and moved on to the next patient. That was all that needed to happen. A doctor noticing. A moment of competence witnessed. The CTA would come back showing exactly what she'd suggested, and Dr. Pierce would hear about it somehow, because this was a hospital and hospitals were like small towns, news traveled. He would file that information away in the way people filed things that bothered them. The kind of things that festered. The kind of things that made someone decide a person needed to be reminded of their place. The CTA came back at 2:44 p.m. Subdural bleeding. Diffuse axonal injury. The radiologist made the same call Katie had made based on nothing but a Glasgow coma scale and clinical presentation. The girl went straight to neurosurgery. Dr. Reeves nodded at Katie as she helped move the patient to the stretcher. That was as close to praise as anyone got in emergency medicine. A small acknowledgement. A moment of recognition. But somewhere in the hospital, Dr. Pierce was learning about the moment when a nurse, a person without a medical degree, without years of training, without any authority to make clinical judgments, had suggested a diagnosis that happened to be correct. He was learning about it, and he was already deciding what that meant about her. The Grand Rounds presentation was scheduled for 7:36 a.m., which meant Katie arrived at Seattle General 30 minutes early, clipboard in hand, ready to present her most recent cases to the assembled physicians. The conference room smelled of burnt coffee and dry erase markers. Dr. Pierce was already there, standing at the podium, his tailored white coat pristine, his wedding band catching the fluorescent overhead lights. He smiled when she entered, the kind of smile that didn't reach his eyes. "Perfect timing," he said. "We were just about to discuss a rather interesting case from last month. Ms. Morrison's case, actually." Katie set her clipboard on the back table and moved to find a seat among the residents. That was when she noticed the case file projected on the screen behind him. Her handwriting. Her patient notes. Her diagnosis recommendation highlighted in red. This patient presented with chest pain and elevated troponin levels, Pierce continued, his voice taking on the measured tone of a professor addressing undergraduates. The standard differential diagnosis, myocardial infarction, pulmonary embolism, aortic dissection, were all considered. The treatment pathway was established. Clear. Evidence-based. He paused, letting the weight of those words settle. And then our nursing staff decided to challenge physician judgment. Specifically, Ms. Morrison suggested an alternative diagnosis. No medical degree, you understand. No formal training in differential diagnostics. But she felt compelled to override the assessment. The three residents in the front row shifted in their seats. One of them, Dr. Chen, turned to glance back at Katie with an expression that landed somewhere between pity and distance. The alternative diagnosis, spontaneous coronary artery dissection, turned out to be correct, Pierce said, his tone making the word sound like an admission of conspiracy rather than competence. Which raises an important question about scope of practice and chain of command. When nursing staff begins to see themselves as co-diagnosticians rather than care implementers, the entire hierarchical structure of medicine becomes compromised. He clicked to the next slide. A job description for a registered nurse. Highlighted passages about providing care under physician supervision and reporting concerns through appropriate channels. This is not about a single correct guess, Pierce continued. This is about the erosion of professional boundaries. This is about insubordination dressed up as initiative. And it's a pattern we need to address before it spreads through our department. He looked directly at Katie. Some people in this room believe that proximity to crisis, that seeing emergencies, that being present in trauma, somehow qualifies them to make clinical decisions they're not trained to make. It's a dangerous misconception. And we have a responsibility to correct it. The silence in the room was the kind of silence that happened when people were deciding which side of a power dynamic they wanted to be on. Katie sat perfectly still. Her hands were folded on the table in front of her. Her breathing remained steady. Inside, something cold and precise had activated, the part of her that had learned to separate her nervous system from her circumstances, the part that had been trained to keep functioning while mortars fell. She didn't blink. She didn't shift. She watched Dr. Pierce finish his presentation and ask for a motion to implement new protocols restricting nursing recommendations in diagnostic decisions. The motion passed with only 2 abstentions. At 9:13 a.m., Katie was restocking the trauma unit supply station when 3 residents approached the vending machine beside her. They didn't lower their voices. That was intentional. "Did you see the way she just sat there?" one of them, Dr. Reeves, whose family ran a chain of urgent care clinics, was saying. No apology. No acknowledgement. Just that dead stare. "Playing soldier nurse," another one muttered. This was Dr. Callahan, third-year resident, whose father was a lawyer with connections to the hospital board. "That's what gets me. She has this whole aura like she's some kind of operator. Like she's seen things the rest of us haven't. Because she hasn't seen anything we haven't, Reeves said. She's just a nurse. People confuse confidence with competence. Katie's hand remained on the supply box she was stacking. The fluorescent light above them hummed with a sound like distant electricity. She didn't turn around. She didn't react. She let them finish. When Dr. Callahan finally noticed her, he had the good sense to look momentarily uncomfortable. Oh. Hey. We didn't. Katie turned. Her eyes were the color of winter water, and they carried the kind of attention that made the room's air pressure shift. She looked at each of them in sequence. Not long. Just long enough. The difference between us, she said quietly, is I've actually had to triage 20 casualties with supplies meant for 5. You can't even manage a differential diagnosis with a full lab panel. She set down the supply box with the kind of precision that made it sound like a period at the end of a sentence. Then she turned and walked away, her badge catching the light as it hung against her scrubs. The 3 residents stood frozen in front of the vending machine. Reeves opened his mouth. Nothing came out. Dr. Pierce was reading through patient intake files when he saw the name on the new trauma admission. Navy SEAL. Medic. Combat wounded. Evacuation from a forward operating base in the Horn of Africa. The patient had been Katie's direct replacement in Ramadi 8 years ago. Pierce knew this because he'd made it a point to understand every detail of her background that she'd been careful to keep private: the timeline, the unit, the location, the specific role. He closed the file slowly. His phone was already in his hand. The first number he called was to his contact in the hospital's credentialing office. The second was to a board member he'd cultivated over 18 months of carefully maintained social connection. The third was to a private investigator who specialized in background checks and reference verification. I need everything, Pierce said into the phone, his voice carrying the smooth confidence of someone who had never been told no. Education records, service history, every reference she listed on her application. I need it fast. He ended the call and sat back in his chair, watching the patient file on his screen as if the answers were somehow encoded in the pixels themselves. He didn't know that Katie had already seen the patient being wheeled into Trauma Bay 2. He didn't know that she had recognized something in the way the paramedics were moving, the urgency beneath their controlled movements, that told her this was bad. He didn't know that she had taken one look at the patient's chart and seen his name and understood immediately what was about to happen. What Pierce also didn't know was that in exactly 6 hours and 43 minutes, everything he had built against her would collapse. But for now, in this moment, with the morning light streaming through the hospital windows and the quiet machinery of the trauma unit running through its routines, Dr. Pierce believed he finally had the leverage he needed. He was already beginning to imagine how he would use it. The SEAL came through the doors at 2:16 a.m., and Katie's entire body recognized him before her mind caught up. Not the patient, the absence of him. The absence of Mendez, who'd taken her spot in Ramadi when she rotated stateside, who'd run 3rd Squad through Jolan District with the same methodical precision she'd taught him, who'd caught shrapnel meant for a corporal and bled out in a convoy truck because the aid station was 7 minutes too far away. This one was different, wrong breathing, shallow and panicked, shoulders heaving like he was pulling oxygen through concrete. Her hands moved toward the chest without her asking them to, reading the clinical story written across his ribs and sternum like a field report. The trauma surgeon on call that night was competent enough for routine cases. Not for this. Katie watched him order the chest X-ray, watched the radiograph pull up on the monitor, watched him trace the obvious findings with his stylus: pneumothorax, yes, air in the pleural space, but not the kind that jumped out at you in the textbook images. This was tension physiology masquerading as a simple pneumothorax. The pressure building, the mediastinum shifting, the venous return choking off millimeter by millimeter. The surgeon saw a pneumothorax. Katie saw the shadow of Ramadi, the tent where they'd lost Rodriguez and Chen to the exact same presentation, where the attending physician in a combat hospital had ordered the textbook procedure and watched 2 Marines die anyway because textbook doesn't account for blast physics and shrapnel trajectories. Needle decompression, Katie said. Her voice was different now, not asking permission, not the deferential tone she wore like a uniform. Just stating fact. Second intercostal space, mid-clavicular line. Right side. Now. The surgeon didn't look at her. We'll get him to the OR. Chest tube under imaging. He doesn't have time for the OR. Nurse, I appreciate your concern, but his pressure's tanking. Look. She pointed to the monitor without touching it, because touching it would have been insubordination and they both knew it. 56/31. The color draining from his lips like someone was siphoning it out with a straw. The breathing getting worse, not better. Each inhalation a losing battle. Immediate decompression. Non-standard location. The surgeon left. He didn't argue further, which somehow was worse. He just left. And Katie understood what that meant. The phone call had already been made. Dr. Pierce had already activated whatever network of favors and professional courtesies he'd cultivated, and now every physician who entered this room would arrive with the same instruction: the nurse is overreaching, the patient is too unstable for aggressive intervention, establish a baseline and escalate through proper channels. The next doctor came in at 3:14. Then another at 3:51. Then a cardiothoracic surgeon at 4:22 who actually looked at the patient, looked at the vitals, looked at Katie's face, really looked at it, the way you look at someone whose certainty registers at a frequency your training recognizes, and almost said yes. Almost. His pager went off. He checked it, and something shifted behind his eyes. The professional courtesy. The phone call Pierce had made to him too. We'll monitor closely, he said, which meant no. By 6 a.m., the count was 7. 7 doctors who'd walked in, assessed the patient, and walked back out again. Katie kept track without writing it down, because the tally lived in her chest cavity like shrapnel. By 9 a.m., it was 12. The SEAL's oxygen saturation had dropped to 71%. His systolic pressure couldn't hold 60. The monitor showed the signs of someone drowning in his own chest cavity, and every physician who passed through that room saw it and saw Katie's face and saw the same message in invisible ink: this nurse has opinions above her station. One of them, a pulmonologist named Hartley, actually voiced it while standing at the bedside. The procedure she's suggesting is not standard protocol for this presentation. Which is why it works, Katie said quietly. Standard protocol got 2 Marines killed in Ramadi when the presenting pathology was identical to this. Hartley blinked. Just once. Then he turned to leave, and Katie understood that he'd heard something in those words, something that didn't match the resume of a 6-month trauma nurse. Something that sounded like a triage protocol from a combat hospital. Something that sounded like someone who'd counted casualties by the numbers they could save with the supplies they had. But he left anyway. By noon, the count was 16. The SEAL's eyes were starting to glaze, that particular flatness that comes right before the nervous system begins its final shutdown. His lungs were working in isolated chambers now, each breath a separate struggle because the pressure in his chest had created compartments of usable air and dead space. Katie had seen this exact countdown in a tent in Anbar province. She knew how it ended. We need to try the needle decompression, she said to the intensivist who'd just arrived. Non-standard location. I can landmark by palpation. We're going to proceed with observation and fluid management. His output is negative. His pressure's at 58 systolic. Observation is a death watch. The intensivist had the decency to look uncomfortable. He also had the good sense to leave the room and make a phone call. Katie could hear Pierce's voice in her head, could see the architecture of it now, each call perfectly calibrated, each physician's professional insecurity weaponized, each refusal stacked on top of the last like a weight bearing down on the patient's chest. By 1:44 p.m., the count was 18. The monitor showed the SEAL's heart rate climbing past 120, the desperate rhythm that comes when the organ realizes it's running out of room to work. Katie stood at the bedside with her hands clenched at her sides, every muscle locked against the muscle memory that wanted to move, wanted to find the landmark by feel, second rib, trace down to the intercostal space, find the pocket where the pressure had nowhere else to go. "Get me a 14-gauge angiocath," she said to the resident who was standing uselessly at the foot of the bed. It wasn't a request. The words came out the way they had in Ramadi when second squad was pinned and the aid station was running out of field dressing. When rank stopped mattering and only outcome mattered. The resident hesitated. Katie turned her head, and whatever she did with her eyes made him move. He brought the needle. She had it in her hand, had the site marked with her fingertip, right chest, second intercostal space, mid-clavicular line, the textbook landmark, when Dr. Pierce appeared in the doorway like something summoned by the universe's worst sense of timing. "Step away from the patient." Katie didn't move. The resident was already backing up, already reading the shift in the room's pressure the way animals read storm systems. Pierce walked forward with a kind of confident stride that only comes from knowing your network is solid, your calls have been answered, your message has been delivered to every attending within 3 floors of this room. "That's an order, Miss Morrison." And that's when the SEAL's oxygen saturation hit 64%. That flat grey number on the monitor, that meant minutes. Maybe 5. Maybe 3. Katie looked at the patient, looked at the needle in her hand, looked at Dr. Pierce's face and saw the moment he realized she was actually going to do it anyway. Saw the moment his confidence cracked, because he'd done everything right according to the rules, and the rules were about to watch a man die. She didn't ask permission. She didn't explain. She just pushed past him like he was furniture and inserted the needle into the second intercostal space, felt the subtle give of tissue, the breach of the pleural membrane, and then the hiss, that specific release of pressurized air that sounds like air escaping a tire but means something entirely different when it comes from inside someone's chest cavity. The hiss of pressure finally having somewhere to go. The monitor did the rest. 64. 67. 72. 78. 85. 92. Stable. The SEAL's shoulders dropped. His breathing deepened. The grey left his lips and colour began its slow return, like someone had stopped draining him from the inside out. Katie secured the needle with tape and glanced at Dr. Pierce, whose entire face had gone the colour of old linen. "I'm going on break," she said. "Page me when the chest tube's placed." She turned to leave, and that's when she noticed the Marine liaison standing in the corner of the room. He had Pierce's expression written across his face, but his eyes were on Katie, and they held something that looked like recognition. Like he'd just watched someone drop a mask so thoroughly that the face underneath couldn't possibly be mistaken for anything civilian. The needle was already in her hand before her conscious mind caught up with her training. 14-gauge angiocath, the same size she'd landmarked by feel in a bombed-out clinic in Ramadi with nothing but moonlight and muscle memory. The attending physician was still arguing when she pushed past him, her movements carrying the terrible efficiency of someone who had already watched this patient die twice in her head. "Step back," she said. Not a request. Not even a question. Her voice had dropped an octave somewhere between the monitors and the decision. Dr. Pierce's network had been thorough. 20 rotating physicians in 18 hours, each one declining, each one citing instability, each one a carefully placed obstacle between this SEAL and the only intervention that would work. She had watched the pattern like a sniper reading wind, Pierce on the phone in the hallway, Pierce's expression when the neurosurgeon left, Pierce's barely concealed satisfaction when the cardiothoracic surgeon refused. The pressure had been systematic. Institutional. The kind of sabotage that looked like protocol. But protocols were written by people who had never knelt in the dust holding someone's hand while their lungs collapsed. The SEAL's oxygen saturation was at 67. Dropping. The ventilator was doing nothing because the air had nowhere to go, his right lung pressed against his heart like a fist, pressure building with every mechanical breath they forced into him. Tension pneumothorax. The kind that killed people in minutes. The kind she recognized the way a mother recognizes her own child's cry. "Get me a sterile field," she said to the resident frozen at the bedside. "Chlorhexidine. 2%. "You're not authorized," the resident started. "Move." She didn't raise her voice. That was the thing about controlled anger. It didn't need volume. It needed only precision, the way a laser didn't need to shout to cut through steel. The resident moved. Someone got the chlorhexidine. The room shifted around her because rooms always shift around certainty, and certainty was the only thing she had left to offer. Her hands moved with the terrifying fluid precision of someone who had done this under fire with mortar rounds walking closer. She found the landmarks without imaging, second intercostal space, mid-clavicular line, her fingers reading the anatomy the way blind men read faces. The skin went tight under the antiseptic. She could smell the chlorhexidine, sharp and medicinal, cutting through the stale hospital air. One breath. That's all she gave herself. Then the needle went in. The hiss came immediately. 2 centimeters of needle, and the trapped air escaped like a confession, decompressing the lung with a sound that only people who had heard it before would recognize as salvation. The monitor picked up the change before the oxygen saturation did. The waveform flattened. The rhythm steadied. The number climbed, 72, 81, 90. 94 in 30 seconds. Sinus rhythm. The room went dead silent. Not the silence of shock. The silence of witnesses watching someone bend the world into alignment with the laws of physics and biology, watching someone prove that 20 physicians and bureaucratic caution were wrong, watching someone succeed in front of an audience that had been guaranteed failure. Blood pressure stabilizing, the resident whispered. 104/62. He's coming back. Katie stepped back from the stretcher. That was when she saw Dr. Pierce in the doorway, his face a photograph of rage calcifying into something worse, understanding. The kind of understanding that comes too late, after you've already moved all your pieces on the board and realized the board itself had changed. He didn't speak. He just turned and walked down the hallway, and she heard him making calls. 3 board members. The nursing director. Her references. His voice carried the tone of someone explaining a termination, someone documenting a violation, someone who had pivoted instantly from sabotage to institutional destruction because sabotage was no longer sufficient. By the time the surgical team arrived for the chest tube placement, she knew it was over. Not the procedure. The procedure was a success that glowed like confirmation. But the job. The position. The credibility that had taken 6 months to build and 48 seconds to obliterate. Dr. Pierce appeared at her elbow as the seal was being transferred to the ICU. His voice was ice water. Your badge. Now. She unclipped it from her scrubs. Handed it to him. The laminated photo showed a woman she barely recognized, someone smaller, someone deferential, someone who had accepted the weight of his contempt without flinching back. That woman was gone. But Katie couldn't say that. Couldn't explain that the procedure was textbook combat medicine, that the patient was responding exactly as physiology predicted, that everything she had done was correct. Because explaining it required saying out loud where she had learned it, and where she had learned it was classified. The Navy intelligence briefing had been clear, the nursing job was the mission. Monitor wounded personnel for security leaks. Listen to what they said in a fog of pain medication. Track intelligence compartments. 18 months embedded in a civilian hospital network, wearing scrubs like a second skin, earning trust she couldn't acknowledge. The SEAL patient was the reason she was here, a specific asset they needed to watch, someone passing through the system with access that made him useful and vulnerable. Blowing her cover meant blowing the entire operation, 18 months of work, the ability to reach anyone else who came through those doors carrying information that mattered. She cleared her locker methodically. The folded flag from her fallen teammate came out first, along with the shoes she never wore, the spare scrub she'd stolen from linen because stealing protocol meant nobody checked too carefully, the small green journal she'd used to document patient conversations that never made it into official records. Everything that proved she had ever been anyone other than the nurse Dr. Pierce had dismantled. The drive home took 23 minutes. She sat in her car in the driveway for another 17, watching rain start to fall in sheets that turned the windshield opaque. The world looked different from the outside. Uncertain. Hostile in the way civilian spaces became when you'd spent too long in the spaces where certainty was a skill and hostile was a job description. Her daughter was at her grandmother's. She had until 6 o'clock before pickup. She had 6 hours to become someone who could explain why Mommy's work trip ended early, someone whose eyes didn't look like they'd seen 20 people choose institutional safety over a man's life. The kitchen table was where she found herself at 3 in the afternoon, still wearing her civilian clothes from that morning, the rain pattering against the window with the kind of rhythm that made you feel like you were drowning even though you were dry. She didn't cry. Soldiers don't cry. But her eyes burned like the sky was on fire somewhere behind her sternum, and she kept pressing her fingers against them as if she could push the burning back inside. The folded flag was on the table in front of her. She'd taken it from the locker on the way out, automatic as breathing. The fabric was so worn it was almost transparent in places, the creases so deep they looked like scars. She held it in her left hand and picked up her phone with her right. 17 missed calls, 9 from the nursing director, 3 from board members, and 4 from numbers that came back as redacted. The redacted ones meant the Pentagon had noticed. The redacted ones meant someone was watching the situation escalate. The redacted ones meant she'd blown her cover and the cover was already blown and there was nothing left to salvage except the lie itself. She was 6 seconds away from throwing the flag into the sink, from running it under the garbage disposal, from doing what she should have done the moment she clipped that badge to her scrubs in the morning. 6 seconds from erasing the last piece of evidence that Captain Catherine Morrison had ever existed in a parallel timeline where she made different choices. That's when she heard the first helicopter. The sound was distant, coming from somewhere east of the city, the distinctive thud-thud-thud of rotor blades cutting air in a pattern that didn't match civilian traffic. She stood up. Walked to the window. The rain was so heavy she could barely see the street, but she could feel it, the presence of something large and military, moving toward her position like gravity. 1 helicopter became 2 became 3, the sound layering over itself until the air pressure in the kitchen seemed to change, as if a storm front was rolling in ahead of schedule. Her phone began to ring. Unknown number. She almost didn't answer. Then something in her muscle memory decided for her, and she heard a single sentence from a voice that belonged to someone she hadn't heard from in 3 years. The SEAL just woke up. Captain. He's asking for you by name. The rain kept falling. The helicopters kept coming. And somewhere in the distance, something was about to change in a way that would make 6 months of humiliation look like a rehearsal. She opened the door and stepped out into the weather, the folded flag still in her hand, and waited for the world to remember who she actually was. The SEAL's eyes opened at 36 hours like a man surfacing from dark water. His chest rose. The ventilator wheezed its mechanical rhythm beside him. Monitors traced the proof of his survival across green screens, heart rate steady, oxygen climbing, the numbers that meant he'd made it through. Katie was adjusting his fur line when his gaze found hers. Not searching. Finding. Like he'd been waiting for her to be the first face he saw when the world came back into focus. He swallowed. Once. His voice came out fractured, barely audible over the machine hum. Phantom. The word hung there. A single word. Her call sign. The one she'd carried in Ramadi before she became a nurse. Before she became invisible. Katie's hand stilled. She did not move. Did not flinch. Did not acknowledge that he'd just detonated her entire operation. Dr. Pierce stood at the foot of the bed, mid-sentence about protocol violations and insubordination. He stopped. Looked at the SEAL. Looked at Katie. Looked back at the SEAL like he'd just heard something in a language he didn't speak. The Marine liaison reading the patient's chart, a gunnery sergeant named Halloway with a scar that split his left eyebrow, flipped back 3 pages. 4. 5. His fingers stopped on a specific line. He read it aloud in the kind of voice that changed room pressure. Previous combat medical officer. Captain Catherine Morrison. Navy Cross citation. Extracted 12 wounded under fire in Ramadi. Operation Phantom Shield, June 2008. He looked up. His eyes met Katie's. He did not salute. Not yet. Captain. Dr. Pierce's face went the color of old milk. The general arrived within the hour. 2 stars on his shoulders. He walked into that trauma bay like he owned the building, because at that moment, in that room, he effectively did. He was dressed in dress blues that held medals the way other men hold certainty. Silver oak leaves. Bronze stars. The kind of decorations that meant he'd seen things and survived them. He looked at Katie's service record. Just looked. Then he did something that made every resident in the room stop breathing. He saluted. Not a casual salute. Full military bearing. Fist to chest. Held there for 3 seconds while his eyes remained locked on hers with the kind of respect that comes from understanding what it costs to do what she'd done. When he lowered his hand, his voice carried the weight of every rank in this hospital suddenly mattering very little. Captain. You're needed back at command. But first, we clean house. Dr. Pierce moved toward the door with the kind of speed that signaled he was about to disappear into the administrative machinery and bury evidence the way surgeons buried mistakes. But he made it exactly 4 steps before the IT director, a Desert Storm veteran named Clayton with forearms like steel cable and a face that had seen things, stepped directly into his path holding a laptop. Every frame, Clayton said quietly. Every single frame. He turned the screen around. Katie recognized herself on it. Recognized the moment she'd performed the decompression. Recognized herself from 20 different angles, 20 different camera feeds. She also recognized Dr. Pierce's voice, amplified and dammed, coming through the speakers as he made phone call after phone call after phone call to those 20 doctors. The patient is too unstable for aggressive intervention. The attending wants him held for observation. If you attempt that procedure and he arrests, you're the one testifying. 20 doctors. Not refusing because medicine demanded it. Refusing because a man with a network had convinced them that helping would cost them more than standing still. You've got everything, the general asked Clayton, already knowing the answer. Sent it to the medical board an hour ago. Also sent a copy to NCIS. Also copied the FBI. Hard drive in the mail to the DOJ. Clayton smiled. It was not a kind expression. I was in Desert Storm, sir. I recognize sabotage when I see it. Dr. Pierce tried to speak. His mouth opened. Closed. Opened again like a fish on a deck. The general stepped past him without looking. Captain Morrison, your mission is restored. Your cover is intact. And Dr. Pierce here has just accelerated his own reckoning in ways I suspect he won't fully appreciate until the paperwork arrives. 6 months later, Katie saw Dr. Pierce through the loading dock window. He was driving a medical supply van for a contractor company out of Marietta. The kind of work that required him to deliver oxygen tanks and bedpans to clinics that couldn't afford to be picky about their vendors. The name tag on his chest read, Steve. Not Doctor. Not Dr. Pierce. Just a Steve. When someone called him by his old title, and occasionally someone did, someone who didn't know, he flinched. Actually flinched. Like the word itself had developed teeth. Katie turned away from the window and walked back into Seattle General, where the new policy had been installed 3 weeks earlier in his absence. The one that Clayton had helped draft. The one that allowed nurses with combat medical experience and documented field competency to override physicians in specific trauma scenarios when lives depended on speed. It had her name on it. Not her nurse name. Her rank. Captain K. A. Morrison, Trauma Protocol Override Authority, effective immediately. The SEAL's dog tags hung beside the folded flag in her locker now. Phantom's tags. The medic who'd caught shrapnel doing her old job. Who'd recognized her in the moment it mattered most. The weight of the metal was nothing like the weight of knowing that her mission had never been compromised. That Navy intelligence was satisfied. That she could stay. When the next trauma case came in, a gunshot wound to the thorax that had other doctors hesitating over the right call, Katie looked at the attending resident and said 2 words. Move back. He did. The procedure took 4 minutes. The patient walked out of that hospital 8 days later with a daughter waiting in the lobby and a future that didn't exist if Katie had followed protocol instead of instinct. If she'd waited for permission instead of recognizing what Ramadi had taught her. Pain was information. Blood was data. And sometimes the quietest person in the room was the one holding all the answers. The general had said something when he left that day. Katie thought about it now, standing at the window of the loading dock, watching Steve navigate traffic in his supply van, watching him flinch when someone called out a familiar name. Power isn't a title. Power is the ability to help. He'd been right. The trembling she felt wasn't fear. It was the restraint of a woman who'd learned long ago that the most devastating thing you could do to someone who'd built a career on dominance was simply to be better than them. Quieter. More capable. More willing to sacrifice everything for someone else's survival. She didn't need a badge anymore. Or a title. Or a general's salute. She had her scrubs. Her stethoscope. Her hands that had held lives together in places where there were no protocols and no board meetings and no authority except the one that came from knowing exactly what had to be done and doing it anyway. The folded flag stayed in her locker. The dog tags hung beside it. And when the next patient came in, the next crisis arrived, the next moment of truth demanded a decision that moved faster than committees could move, Katie Morrison stepped forward exactly as she always had. As a nurse. As a captain. As a woman who'd learned that sometimes the best way to change a broken system wasn't to destroy it from the outside. It was to rebuild it from within, one decision at a time, one life saved at a time, one moment of quiet competence at a time. The room didn't need her to announce herself anymore. They already knew. If you're still watching, hit that like button. And I want to know, would you have saved the man who fired you, or walked away? Drop your answer in the comments. Subscribe and let's see how this ends.